And wouldn't it be neat if we could simply turn that back on and repair tissues to their original grandeur and functionality, and to do it with a product that's safe, scalable, and meets the demands of the healthcare system? People often joke, why is a guy whose training was in surgery and neurosurgery, why did I stumble upon the placenta as a source of cells for this emerging field of regenerative medicine and cellular medicine? And the answer is really simple. I was convinced that unless someone pharmaceuticalized living cells, turned them into such a standard, reliable, consistent product that could be deployed at great scale with logistic and economic capabilities that could fit the healthcare system, I was concerned cellular medicine would go nowhere. And here we had this incredible leftover of a full-term healthy pregnancy being discarded. In fact, hospitals pay the discard of it. And I said, wow, this is sort of like crude oil. And as such, it could be put through a refinery type process. And from that biological crude oil, we could get stem cells, and stem cells could be used to produce pretty much anything. We can get immune cells, and we can get byproducts like biological materials, structural materials, and we could even get these tiny little offshoots of cells called exosomes. And so in the grand scheme of things, I saw of no better resource for this industry than the leftovers of a full-term healthy pregnancy. It just made complete sense to me. Around the time that I was on the faculty of neurosurgery at Cornell, and I was very interested in head and spinal cord injury, I also took an interest in what was going on in the field of fetal surgery. And fetal surgery is a unique specialty where, because we have tools that allow us to identify diseases that are in a developing fetus that are potentially treatable, that you can actually surgically expose that developing fetus in utero. You can perform the procedure and then allow the fetus to return to the womb and complete the pregnancy. And the perfect example of that is spina bifida. Spina bifida is a developmental disorder where the skin and tissue that should be covering the spinal cord and the developing spinal column doesn't close. And that exposure of the spinal cord and spinal column actually leads to progressive loss of function and, in many cases, long-term paralysis. So fetal surgeons are able to identify that at a time that they can surgically repair the defect, allow the fetus to complete the pregnancy, gestate for the balance of the 9 months. And then when born, what's remarkable is that there's no evidence of the surgical repair. There's no scar. There's no remnants of that procedure. It's kind of perfectly remodeled the way nature intended. And the reason behind that, in my mind, had to be linked to this amazing organ, the placenta, that the fetus is still connected to. And because of my efforts to identify an ideal source of cells and other materials for this emerging field of regenerative medicine, I saw that as a testimonial, if you will, as to how powerful the placenta could be at restoring some of the regenerative power that exists at some time in our life, but we lose during our lifetimes. And wouldn't it be neat if we could simply turn that back on and repair tissues to their original grandeur and functionality, and to do it with a product that's safe, scalable, and meets the demands of the healthcare system? I have always felt that nature is a lot smarter than we are. And nature has equipped us with a repair kit. The repair kit exists in the form of stem cells that populate different parts of our body, either resident in our bone marrow or in compartments in every one of our tissues and organs. And that repair kit is called upon in response to disease or injury, and will actually participate in the regenerative process. We think of it as the repair process, but it's actually, when you cut yourself, that repair of the cut is actually a regenerative event. You have cells that are dividing and maturing and specializing to replace the damaged skin and to return it to its original anatomic and functional state. Now, that's what we want to turn on in any patient we're treating for any disorder. If the factor which is responsible for all that resides in a specific kind of cell, a regenerative stem cell, and we could turn that into a medicine, think about how powerful that could be for treating a whole range of diseases and injuries. So, as I said before, my the first part of my professional, medical, and scientific career, I was very focused on severe brain injuries as a consequence of trauma and severe spinal cord injuries as well. And many of you will remember that if you go back 20 years, a severe head injury usually was associated with a very bad outcome. Patients either didn't survive or they had long-term serious consequences that changed their lives. Either led to things like severe cognitive dysfunction. You can't interact with your environment properly. Mobility problems. People couldn't, obviously in spinal cord injury, but even in brain injuries, people would often lose the ability to control their limbs. These are things which are so incredibly severe and so life-altering. I was convinced that if we understood the biology of that problem, we might find strategies that would allow us to respond. And in the sense of responding, I mean doing something that was aimed not at just maintaining the status quo in the patient, but actually returning them, restoring their function, turning back on some of those processes that are necessary to regenerate, new brain tissue, new spinal cord tissue, and so on. We all know that there are some animals in the kingdom, the animal kingdom, that have this kind of reserved or preserved regenerative capability. We think about a salamander. You cut a salamander arm off, and it regenerates. So maybe the best way I could describe it is I wanted to unlock our inner salamander, and direct that biology to repair things that were damaged as a consequence of a traumatic event. And obviously, if it works there, take it into the broader landscape of neurologic disorders and diseases. Lo and behold, upon the discovery of the placenta as a great source of these cells that could meet the potentially vast number of clinical opportunities, I got completely dedicated to better understanding the biology of those cells, the mechanisms that turn on and turn off their different activities and behaviors that were clinically and therapeutically useful, and then coming up with a model, an industrial model, if you will, to turn those living medicines into products that could fit easily into the healthcare system so that any doctor, regardless of their specialty or training, could deploy them in as simple a manner as possible. And I said before, nature's a lot smarter than we are. I was convinced from everything I saw that you don't necessarily have to get very specific on where you put these cells. If you allow the natural signals that direct their trafficking, you could just deliver them through an intravenous infusion. Now, intravenous infusion is a very easy to deliver modality for getting these regenerative agents into patients in response to their injury or disease. So at a time when I was gaining greater insights into just how powerful the biology of stem cells and the potential of regenerative medicine could be, I realized that unless somebody turned these living cells into products that physicians, surgeons, healthcare practitioners could deploy in the conventional healthcare setting, these breakthroughs might lead to really limited use, and that, in my mind, would have been tragic. I mean, it's The best example I can give is we know that whole organ transplantation is not only effective and not only life changing for patients, but we've developed all of the associated capabilities to do it with a high degree of safety and efficacy. And it would be done all the time if there was availability of these organs readily. If we could have them on the shelf, so to speak, replacement parts. Think about how easy it would be when your blood vessels in your heart start going bad. Just replace the whole heart with a new heart. When your lungs start working ineffectively, just get rid of them and put a new set in. The surgery, the transplantation surgery, is pretty straightforward, and we've perfected that. Likewise, I was concerned that unless somebody was to actually create off-the-shelf living cells for this industry, this might go the way of organ transplantation. We know it works. It'll be used in a tiny fraction of the opportunities where it can be used. And patients in the grand scheme of things will not derive all the benefits they could by having a readily available, high quality, economically viable cellular medicine, regenerative medicine product. And so, for me, the obvious factors that had to be taken into consideration were, what do you have to do to produce a living cell like a medicine to a pharmaceutical standard? And all of that's important because it means that healthcare practitioners will know how to use them. They can use them in the settings that they're already used to treating patients. And the products can be deployed across the board to many, many patients and still fit the healthcare system in terms of its infrastructure, the economics. Is it going to be affordable or not? And we also want to be able to use the same technology, the same cellular technology, to treat patients with maybe more than once, maybe over periods of time. And then the issue is, what does this mean for not just kind of treating acute problems, but what does it mean for the future of treating things like age-related degenerative diseases? And that's where I got incredibly excited. Everything intuitively told me that part of the reason we age and part of the reason that we don't age gracefully is that we lose the ability to remodel and renew ourselves, our organs and our tissues over and over and over again. And as we age, as we lose that regenerative engine, if you will, that engine stops working properly, we begin to accumulate age-related defects. So if you look at your skin, for example, you look at the skin of a baby, it's very elastic, there are no wrinkles, it's got great texture, retains water. Look at the skin of an 80-year-old, and it doesn't have the same mechanical characteristics. It's not nearly as elastic. It doesn't retain water as effectively. It accumulates damage like wrinkles and sun damage and so on. So if you use that as an example, what's different between the baby and the 80-year-old? Well, one of the things is that the stem cells in those two different times of our lives are dramatically different, both in quality and quantity. So maybe a simplistic view is, if I know that stem cells play a role in renewing and remodeling us as we age, and they are perishable, or you can run out of them, or their quality can go bad. If I could create a resource that would allow me to continually have access to cells, young cells, to put into aging individuals, could that in fact be a strategy or a tool to use to offset some of these degenerative processes that rob us of the quality of our lives as we age? In spending time looking at this problem and coming up with some experimental models and some research to validate whether it's in fact a mechanism that we should be looking at, it became very, very clear to me that this might be one of the easiest, most reliable, most approachable ways to, over time, in a proactive way, restore the youthful regenerative engine that we lose as we age. And would that result in us living healthier, longer, and better? And if that thesis held up, it's one of the great, in my mind, it's one of the great contributions that can be made to healthcare. So, the road to getting a product that is registered and approved by the Food and Drug Administration of the United States and the regulatory agencies around the world requires a very high standard of safety and efficacy. Safety, first and foremost, has to be demonstrated reliably with a consistent product that would be introduced into clinical applications. The efficacy, how good it is at doing what it's supposed to do in response to illness or disease, is a relative measurement, and that's based upon the disease that you're treating, how safe the product is, and a number of other factors. All that being said, when I think about the kind of tools that are being thought of to treat age-related diseases, I can't think of anything that's more elegantly simple, and as long as it's produced at quality, scale, and economics that fit the healthcare system, in my mind, I'd rather have that as a treatment than any of these synthetic chemicals or other products that still have a very, very high bar to pass. You know, as a surgeon who recognizes that we can cut things out and put things back in, in my mind, one of the easiest ways to deploy cell therapy is just to put them into the circulatory system. You know, the highway that can provide access to literally every tissue and organ of the body. And let nature do the rest. Let the natural signaling mechanisms that recruit and sequester stem cells that are circulating in the bloodstream where they have to go. If we allow that to take place, again, my expectation was that you would see the clinical benefits that we envision. One of the fundamental challenges in designing a therapeutic that's a biological therapeutic is you have to be able to deploy it to patients without having to customize it for them. It has to be a one-size-fits-all product. That is one of the great gifts nature gives us in the placenta. So I want you to think about this for a second. The placenta is, when I was in medical school, we were kind of taught the placenta is a vascular interface between the mother and the developing fetus, and that as such, it's responsible for allowing the fetus to basically get access to oxygen, nutrients, get rid of waste, and so on across this kind of unique organ barrier. And back then, I said, well, okay, well that sounds pretty interesting, but when you actually look at a placenta, it doesn't look like a vascular interface. It doesn't look like it's just a connection between the mother and the fetus. It looks like in my mind, more like a bioreactor, like an environment where cells propagate, differentiate, traffic, move around. And that made more sense to me, that in fact what the placenta is it's a factory that helps participate in the production of that developing fetus. One of the phrases to describe this that I've always liked, my dear friend and partner, Dr. Peter Diamandis, often says that the placenta is nature's 3D printer that prints the baby. That's kind of an interesting way of thinking about it, but in fact, when we looked, we found that the placenta is designed to house stem and progenitor cells. These are cells that give rise to other cells that mature and specialize. The placenta is basically the environment that this takes place, and these cells move from the organ itself, the placenta itself, into the circulation that gets into the developing fetus, and some of those cells will take up residence in the fetus and participate in the production of that newborn. All that being said, what would make the placenta an ideal source of these cells for the regenerative applications that we've been talking about? So first and foremost, in my mind, for cell therapy to really grab a foothold in healthcare, these products have to be completely one size fits all. One donor has to be able to be used in any recipient without the need to match them the way you match organs for organ transplant. And it turns out that when you think about it, the biology of the placenta is designed to make it capable of existing in a foreign environment for 9 months without rejection and without stimulating an immune conflict that would either damage the viability of the pregnancy the fetus itself or the mother. And so thinking about the placenta as nature's universal donor tissue, try and figure out where the best examples of that are. And the obvious one is that since a mom carries a fetus and its placenta for 9 months, she's only a 50% source of the DNA in that fetus, yet, and that imperfect match is tolerated. That's pretty cool. Well, what about the fact that in surrogate pregnancy, the mom's not even related to the developing fetus? There's, in all likelihood, a zero match between the mother and the fetus. Yet, she carries that fetus and placenta for 9 months, doesn't reject it, it doesn't reject her, and she doesn't develop any long-term ill effects from that, and neither does the newborn. So, again, nature is a hell of a lot smarter than we are. And I was convinced that mammalian evolution would never have occurred because the combination of the mother and the father's unique DNA to form a unique offspring will always, at best, be a kind of a partial match. This mammalian evolution was dependent upon the placenta developing the mechanism to be tolerant and be tolerized by the maternal host. And that particular biology, if retained in the cells and tissues from the placenta, meant that it was the ideal source of what we call allogeneic, one-size-fits-all cell therapy products. So that is just one of the remarkable biological attributes of the placenta that, I don't think we're the first to recognize it, but we were kind of the first to pay enough attention to actually put it into practice and use it for those purposes. So staying on the theme of, what makes the placenta so great for this cellular medicine, regenerative medicine field. And one thing which cannot be overlooked is that your biology is pretty much at its absolute perfect condition at the instant of birth. You've been developing inside the maternal host, the mother's womb, and upon birth, a healthy newborn has gone through nature's quality control process. Has a little tag that it comes with that says inspected by. And the quality of the biology at that instant, in my mind, is the perfect place to go looking for cells that you would take and manufacture into a therapeutic. As we just mentioned, it would be a one-size-fits-all allogeneic product. The cell from any placenta could be used in any recipient without the need to match. These cells are pristine in the fact that they haven't been exposed to all of the things in the environment that damage our DNA and damage other parts of the machinery of the cells. They have incredible proliferative capability. So think about this for a second. You're a human being, you have 30 trillion cells that continually recycle and renew and so on. Every cell in your body has roots back to a cell that came from the placenta. So if you think about a 90-year-old or someone who lives to 100, every cell in that individual originated all the way back in utero to cells that were derived from the placenta. So think about the what we call the differentiation, the going from a stem cell to the mature specialized cells. Think about the differentiation fidelity of cells from the placenta. They can give rise to trillions and trillions of cells over your lifetime, and each one of those cells is of the quality necessary for you to be a living human being. So something about these cells makes them ideal for the mass production of therapeutic products that, when administered, will have a long, stable life in the recipient. Best example of that is what we've learned in bone marrow transplantation, where we clean out somebody's bone marrow, usually because they have cancer, and we infuse them with stem cells that are capable of going back to that bone marrow and remodeling it. Well, the younger those cells are, the better the outcome, the better the long-term benefits are to replacing that bone marrow. So we know that all of this is relevant to the field of cellular medicine, and we just simply are good observers, I think, and we spent enough time and we had the resources to evaluate and to study what these biological properties are, how important are they to medicine in general, and are they the basis for investing in developing true, broadly deployable, broadly disseminatable cellular medicines to treat serious diseases, chronic illnesses, and ultimately to be, again, part of the toolkit we use to treat virtually any injury or disease. That was what has driven so much of the investment of time, capital, infrastructure, and other resources to build an industry around cell therapy. So people often ask me, hey Bob, you're a trauma surgeon. How did you stumble upon the placenta as a place you want to invest all your scientific and professional efforts around? And as I've said, I believe that cellular medicine would transform healthcare. And I had an epiphany around the birth of my first child. And it was when my daughter was a peanut-sized embryo in the uterus that I looked at the first trimester ultrasound and was dumbfounded by the fact that although at that first trimester she was a little peanut-sized embryo, the placenta was already a large organ, much bigger than I had expected. If it was just a vascular interface between the maternal and the fetal system, they would probably develop at the same rate. It appears the placenta developed at a faster sort of a rate way ahead of the development of the fetus. So that suggested to me that it must play a role in governing or facilitating that development. And if that was the case, why? So using kind of an engineering mindset around this and approaching it as principally an engineer, I said, the placenta must in some way control the overall process of embryogenesis and fetogenesis. And how could it possibly do that? It must be producing some product that is responsible for creating a newborn. And what could that product be? And lo and behold, it seemed pretty obvious that product had to be a cell, most likely a stem cell. And it was that which directed my attention to exploring the placenta. And it was during those early explorations that we uncovered that, in fact, that's what the placenta is. It's a stem cell factory. And as a stem cell factory, at the end of a full-term pregnancy, when it's being expelled and thrown away, that seemed to me to be a terrible waste. And so we took the time to collect these, evaluate them, experiment to see what exactly they could be used for. And that's what has given rise to the entire technology platform we use today to derive cells to do everything from treating cancer to treating degenerative, age-related degenerative diseases. I think about the collection of and processing of the postpartum, the leftover placenta from a full-term pregnancy, as kind of analogous to the refinery business around oil. And yes, crude oil is a composite material that's collected out of a well, and then the manufacturing process creates a whole range of derivatives, from fuel oil to gasoline to kerosene to hydrocarbon materials that are used in plastic production. The same kind of thing is how we approach the use of the placenta. So the placenta is this big meaty organ that we can isolate cells, and those cells can be used to give rise to stem populations and immune cells and so on and so forth. But we also are left with the tissue that makes up the organ, and that tissue is comprised of important structural proteins and other molecules that are necessary for repairing our skin, our organs, our bones, etc. So the effort was made to create a manufacturing process that from a single source material, the leftovers of a full-term healthy pregnancy, from one source material, we could recover tissues, structural biomaterials, cells, including stem cells, byproducts of cells like exosomes, and even the proteins that are left over in the blood and sera that circulates through the organ. So when you think about it, the placenta is remarkably similar to crude oil, and we, in fact, will continue to invest in innovating and finding new ways to get more and more out of this incredible source material. I mean, there's even work that we've done that has shown that the placenta might even serve as a source of what we call organoid templates, pieces of organs that we can remove the resident cells and then repopulate with cells of our choosing and create tissues and replacement parts that could be used in everything from augmenting the function of organs that are failing, like the liver, to replacing skin in burn patients.